We say welcome to Kevin Sabet, who is a special advisor to the ONDCP. Good afternoon to you, Kevin.
Thank you very much for having me.
I would like to ask you about what future challenges you think that is facing the United States at the moment when it comes to drug policy.
Well, I think, frankly, the challenge is making sure that we've made a good argument to the American people that this issue really matters, and it affects their life. You know, it's a much more difficult case to make, given the low level of media exposure on this issue, certainly relative to 20 years ago, when even in the midst of heading to a recession and a war and other national security concerns, drugs were still the number one issue on Americans' minds in politics. So, you know, it's obviously a different day, and that does present challenges. And as the director said, it presents challenges for us to get some oxygen on this issue. But we think that it is a very important issue, given a lot of very recent statistics, chief of them being that the rate of drug overdose deaths has risen dramatically and significantly over the last 10 years to about 38,000 for 2006, which is the last year for which we have data. And while casual drug use has been reduced or sort of remained steady, drug overdose deaths are now the second highest cause of accidental death after motor vehicle crashes. And even in some states, it exceeds motor vehicle crashes. So, and that is driven mainly and primarily by prescription drug abuse. So that's a major issue that we are dealing with. It's challenging because the prescription drugs, they're not bought from the usually from the dealer behind a gas station and wrapped up in a little bit of tinfoil. So the fact that they are out of people's medicine cabinet by and large presents some very challenging issues in convincing people that this is actually a problem. So certainly that's chief among our concerns. We've also seen a rise in drugged driving. There was a survey that was done every 10 years on the road. A couple of years ago, they added people testing positive for a legal or illegal drug, and they found that 16% in their study of nighttime weekend drivers tested positive for an illegal or legal drug. That's pretty significant. So we're also very concerned about that issue.
Now, on this side of the Atlantic, we quite often hear about legalization of marijuana, which is not really a topic in Sweden, but obviously there are some pretty strong forces pushing for this in the United States. Is there anything that you could comment on that?
Well, there has been renewed calls, but Director Kurlikowski has been very plainly straightforward in his reaction, and that is that legalization is a non-starter in the Obama administration. It's not an issue that the director and the president talk about when they discuss drug policy. It's not on our radar at all. We know that legalization would result in increases in use and therefore harms, and we've been very straightforward in saying that we are against those efforts.
As for medical marijuana, which is another issue, as far as we have understood, the federal Supreme Court says that this should not be allowed, whereas the different states in the United States, presently 14, I think, have decided that medical marijuana is okay. Do you have any comments on that?
Yeah, the Supreme Court decisions that marijuana is not a medical necessity can be used in a defense, and also that the federal government has within its right in the Controlled Substances Act to enforce federal law, which of course states that marijuana is illegal. We just think that medicine should be determined by science and not the ballot box, and we think of that about every kind of medicine. We wouldn't ask the American people to when there's a new drug that we're experimenting on for ADHD, attention deficit disorder, we wouldn't ask, the American people, what did they think about it? It's not a subjective question. It's a, objective science to determine that. And from what we've seen so far is that, smoking anything is very problematic, especially for medicine. So, we just think that science should determine this, and not the electoral process, which is subject to political, swaying of the political wind wherever it's going.
How has your drug policy message been received internationally, in international cooperation with other countries? Could you comment on that?
Well, it's received extremely well. We just returned from the Commission on Narcotic Drugs in Vienna with the director heading the delegation, and then when he left, the deputy director, Tom McClellan, who's been an incredible asset for our office also, heading the delegation. And it was remarkably successful. We had really what I would consider a breakthrough with Europe on the issues surrounding HIV, appropriate prevention, treatment, and aftercare. There's a lot more agreement than disagreement. We tend to focus on the small amounts of disagreement, but we would agree on 80 to 90% of the issues there. So we were actually able to sit down and have that conversation, which was really wonderful. Another thing that was great is that the director gave his opening remarks, which discussed our national drug control strategy, and people were really listening, and they really wanted to hear what President Obama's first drug strategy would be. They're very open and receptive to knowledge exchange. The director had multiple bilateral meetings with different countries, really discussing demand reduction, even with countries like Russia. Traditionally, supply would dominate the conversation. Director Kurlikowski has been very clear that we need to give public health the proper billing, along with public safety. So it has been received extremely well. We're very excited about the future partnerships moving ahead.
Okay. We thank you, Kevin Sabet from the ONDCP, for being with us. Thank you very much.